Hi, my name is Sierra and we're going to be doing a newborn assessment today. First, we're going to start off with cleaning off our baby. Now we get rid of the linens. All right, next we're going to go ahead and weigh our baby and zero out the scale. Okay, she's 6 pounds or 2.7 kilograms. Now we're going to go ahead and measure her length. Length is 20 inches or 50.8 centimeters. Next, we're going to check her head circumference. And that's 14 inches or 36 centimeters. Now the chest area, 13 inches or 32 centimeters. And lastly, the abdomen. And that's 12 inches or 31 centimeters. Okay, next we're going to listen to her heart sounds in all 5 areas. All right, heart rate is 120. Now we're gonna listen to her respiratory rate as well as lung sounds. Respiratory rate is 40 and her lung sounds in the back. Let's listen to those as well. All right, clear and unlabored. Now for her bowel sounds. Bowel sounds are active. All right. Okay, next we're going to see that her spine is in a C shape and the buttocks are symmetrical. Now that she's on her back, we're going to go ahead and test the trunk incurvation reflex by just tracing our fingers along the side to see if she turns in that direction. And she does. Now the other side. Okay. And we see that she does a little bit of a prone crawl forward. And there is lanugo present on her back and on her arms. And a little Mongolian spot on her buttocks, which is normal. There's no rashes, her skin is smooth, no edema, and then we're gonna go ahead and face her forward and take her temperature under her arm. Okay, temperature is 98.6 Fahrenheit. Now looking at her skin, it is appropriate for ethnicity. We're gonna go ahead and test that skin trigger. And we see that there's immediate recoil. There is a little bit of vernix on her neck and on the back as well, but that's normal. I don't see that she's in any pain, so we're gonna go ahead and test her reflexes, starting with the Moro or startle reflex. All right, that's good. And now checking her blink and pupillary reflex as well. All right, cornea is present and pupils constrict, and she does blink. Now testing the rooting and the sucking. Just kind of graze my finger on the cheek area. All right, good. And now for the sucking, she does have the hard and soft palate intact, as well as the tongue is freely movable. Now we're going to test the palmar and plantar grasp. Okay, her fingers curl up, and then as well as there. And now we see her toes curling. And now for the Babinski reflex. So we do an upside down J. And there we see her toes flaring and the toes curl as well. Now for the tonic neck fencer. So we're going to turn her head towards the side and just see if her arm stretches in that direction, which she does. And now on the other side. All right. Next, we're going to check the stepping reflex, and we're going to kind of lift her up and see that if she steps a little bit, and she does. Now we're going to go ahead and palpate the head. There's no molding present. The anterior and posterior fontanelles are flat and no bulging. No kaput, and there is no cephalahematomas either. Okay, we see that her face is symmetrical. There's no extra marks from forceps or vacuum, and there is a little bit of milia on the nose. We're gonna check if she can breathe through both nostrils by just placing a finger on each one at a time. Okay, good. And now we see that the eyes line up with the ears. Feeling the ears, there is a little bit of cartilage on top, and ready recoil is present. There is a meatus present on each ear canal, and she does turn in the direction of her mother, father when they talk, so she passes the hearing test. All right, just looking at the eyes, they're both symmetrical. Sclera, cornea present, conjunctiva is nice and pink. Her eyes are dark and the lashes are present. Okay, so for the neck, there's no extra nuchal folds, a little bit of vernix, and freely movable the neck, and when we check the clavicles, they're intact. So for the chest area, it is flat and appropriate expansion and retraction. The abdomen, we see that the umbilicus clamp is present, a little bit of Wharton's jelly, and we can't feel a heart rate, so it's drying. Now for the femoral and inguinal pulses, they are present, 2+. Okay, now the extremities, the arms and legs are flexed and freely movable. We see 5 fingers on each hand and 5 toes on each foot. Good flexion, they're symmetrical. Now we're gonna check for dislocation by just lifting up her thighs. All right, and out. Okay, no clicking, so no dislocation present. All right, so she is a girl, so her genitalia, we're looking for the mons, labia majora, labia minora, and the clitoris, and those are all present. I don't see any bleeding. Her skin color is not yellow, so there's no jaundice. And she urinated once a day and had a meconium bowel movement. And that is it for our assessment. Thank you.